Well, good afternoon. Thank you for joining us today for another Leadership Dialogue discussion. I'm Joanne Conroy, CEO and President of Dartmouth Health and the current chair of the American Hospital Association Board of Trustees. I'm really looking forward to our conversation today as we speak with a national expert, David Zuckerman, about his insights and perspectives around a core mission in healthcare, improving and investing in the health and well-being of our communities. There's a broad lack of understanding about how hospitals and health systems provide benefits to their communities outside the world-class care we deliver within our walls. The truth is, there's a lot of great work being done in the field outside the bricks and mortar. We partner with and we invest in communities, in the businesses in the communities, in the nonprofits that are our partners and others to make sure that those we serve have the best chance to thrive and live healthy lives. Our goal is not only to ensure our community members have access to needed medical services, but they also benefit from our investments. We've taken this mission to heart with the launch of the 2022 Center for Rural Health Equity up here at Dartmouth Health, whose mission is to give voice to the communities about what they need most to thrive, and then to invest in those mutually beneficial ideas. Health does begin by investing in the community, in critical resources such as housing, transportation, daycare, and most importantly, in the people in our communities. At Dartmouth Health, like other organizations, we're deeply committed to meeting the unique needs of our patients and our community. And we're doing so through pursuit of an anchor designation status. And now I get to introduce David Zuckerman, who's president and founder of the Healthcare Anchor Network, to discuss this concept further. David is a national thought leader and is incredibly passionate about the role of health systems as anchor institutions and our important work in building community wealth and inclusive economic development. He's authored many reports on place-based impact investing, hospitals building healthier communities, and it was a contributor to the Surgeon General's report on community health and economic prosperity. So David, you work with health systems across the country that have adopted the Anchor Mission Framework, and the numbers are growing of hospitals and health systems that are committed to helping you with this work. How did you get started on this path?
Thanks, Dr. Conroy. I really appreciate the opportunity to be speaking with you today. And I've been on this path for a bit more than a decade, and it really started with looking at what are some of the big ideas out there that are rooted in community that really could get at addressing the deep racial and economic inequities within our society. We often talk about really big ideas in this country, and for me, I needed to see a path to bringing them to reality. And what really attracts me to this idea of the Anchor Mission and the role that anchor institutions can play in their communities, and in particular, the role health systems can play as anchor institutions, is that it's a deeply practical framework with transformative possibilities. And for the last decade plus, I've been researching what are some of these examples and helping other health systems not only understand what are some of the best practices in how they can leverage their hiring practices or their purchasing or their investment, but how to make it a holistic strategy that really can allow for the full expression of this idea to become a reality within communities across the country. And so I've been researching it, but I also think I'm a passionate advocate for what I think is the transformative potential of this idea. And so around 2017 had the opportunity to bring health systems together to say, can we do more than just look at examples from across the country? Is there an opportunity to learn together, identify gaps that we can scale solutions to? And that became the Healthcare Anchor Network, which had 11 co-founding systems. Dartmouth Hitchcock at the time, a couple months later, became one of our early members of the Healthcare Anchor Network. And we've grown today to 75 members from across the country, representing just under 40% of healthcare and our independent 501c3. So been excited about that journey and really think there's so much more we can do. And we're just really in the early days of what this idea could look like.
So I've started a few not-for-profits, and it is hard work. So what were you doing when this became a glimmer in your eye to actually bring it to fruition? So was this something that you were considering after you completed your degree training, or where did you start thinking about launching something like this?
Yeah, so fortunately, I didn't have to do it completely from scratch. I started as a employee at the Democracy Collaborative, which was a think and do tank, which talked about big ideas for how to make more equitable the political economy of the U.S. And part of the do part was what are the role of large institutions and communities. And so really within that organization, I had the chance to begin to do the research, begin to build the relationships, and was really asked to build the strategy for how to engage healthcare. And then fortunately, we had some champions within healthcare systems across the country, within Kaiser Permanente, Trinity Health, Common Spirit Health, that saw the potential of this idea and said, okay, we need to form a national conversation. We need the Democracy Collaborative to be the backbone. And then after the Healthcare Anchor Network was formed, really with the support and collaboration of those health systems, we then had a very quick timetable during the middle of the pandemic to spin the organization out as its own standalone nonprofit. And so that happened over the course of 2021. And since January 2022, we've been fully independent. So fortunately, had a little bit of a runway, but yes, it was a incredible experience to have that opportunity to stand up the organization, and really excited to now be able to fully focus on how do we scale this idea within healthcare, and also encourage healthcare to think about its role within its communities to bring along other anchors to create local collaboratives that can accomplish this work in place and really ensure that, of course, no one institution can solve issues of poverty and racial inequities on their own. It takes all of us. And we believe at the Healthcare Anchor Network that health systems need to be the tip of that spear, but they need to be working with higher ed, they need to be working with public institutions, community foundations, other institutions to share that principles of being an economic engine or having significant resources they can leverage, as well as a nonprofit or public mission. And I believe the combination of those two just allows an organization to think long term in a way that it might not be able to otherwise.
Yeah. There have been some amazing things that your members have done. Talk about a couple of them that have really impressed you in terms of the impact that they've had on the community.
Yeah, so it's where to start, right? I mean, if I don't name some, I might get in trouble. But I'll name a few that really come to mind as I think powerful examples of what this work could look like. One is work that was done in Cleveland, Ohio, over the last decade, in which Cleveland Clinic, university hospitals, again, working with Cleveland Foundation, other partners said, we have supply chain needs. We have a business problem, and we also can use that as an opportunity to think about an incredible social impact we can have at the same time. And coming out of that process was a recognition that commercial laundry, a critical supply chain need for every health system in the country, is a very problematic industry. There are very few suppliers. The quality is suspect often. And could you create a community-rooted solution that also provided jobs for those that were justice involved, individuals who have a difficult time getting jobs elsewhere, right? But they need a second chance. Can you ensure that those jobs were living wage and had health insurance? Again, bring people into the commercial payer system. Can you actually have a profit sharing strategy so they're not just living paycheck to paycheck, but have an opportunity to build wealth? And can this commercial scale laundry also have sustainability principles? Because that was an important priority of Cleveland Clinic and university hospitals to reduce their climate footprint. And so coming out of that process was an effort to create what's now known as the Evergreen Cooperatives, which is starting with a commercial scale laundry that employs more than 200 people, has all of those benefits that I listed. And I think that's the principle of what can happen when organizations collaborate. And it's rooted around a business need that needs to be solved, but there are creative people thinking about what is the additional social impact that we can have at this moment in time, right? They could have just gone with a traditional commercial laundry.
Mhm.
Instead, it's an impact for really community transformation. So that, and now other organizations are looking at adapting that. Just the other day, there was an article in the Chicago Press how Rush is adapting that model for their community, also looking at commercial scale laundry, but putting it within a larger incubator that's going to have floral companies that are minority owned and have other types of businesses that will serve the west side of Chicago and hopefully be a catalyst for transformation for that community. So that's one, I think, really powerful example
Yeah.
on the supply chain side. And I can talk about some on the investment and the hiring side if that would
So
be helpful too.
talk a little bit first about putting on the food insecurity side, because I
Sure.
think there are a number of hospitals and health systems that have identified that as a community need and somehow married that with their either growth strategy or their clinical strategy.
Yeah, so I think core to the anchor strategy is where are there um, business pain points or that intersect with community priorities, and what is an overlapping strategy that can address both. And so on the food insecurity side, where we've seen that most show up is around the opportunity to leverage investment, impact investment. And that's, I know, something that Dartmouth Health has really been a leader on around impact investment in affordable housing. And that was actually going to be one of the innovative examples I was going to talk about from a rural aspect. But on the food security side, we've seen a number of health systems see this as a way to get more dollars to support grocery stores coming into communities. Boston Medical Center has provided a low interest patient loan to a minority owned grocery store operator to come into a community that didn't have that food access. Hawaii Pacific Health has provided capital to support the growth of local food entrepreneurs. And so in this way, these aren't charitable donations. These are investments to grow the local food ecosystem and also support communities that have historically lacked resources. There have been some organizations that have thought more upstream about their grant making. And my perspective is that's really important. And there's never enough grant dollars to go around, which is why thinking about impact investing and leveraging the balance sheet in other ways is really an important strategy that organizations should consider. But you have organizations like ProMedica that saw this as an opportunity to attract a large philanthropic supporter to help create a grocery store that actually ProMedica still owns. And I
Yep.
think that's a powerful example of, again, how do we think creatively about how do we address these gaps with sustainable solutions, right? The goal there is for that grocery store to break even, make a small profit. It's a very tough business. I actually used to serve on the board of a food co-op here in Tacoma Park, Maryland. It's a very tough business, very small margins. But at the same time, it's an important amenity that every community needs if we're going to address issues of food insecurity. University Hospitals in Cleveland, as part of a build out of one of their facilities, that they went through a very intentional process to get community input on, make sure it really met community needs from a clinical perspective. Also heard that it would be really important that it had a grocery store sited nearby. And so as part of that project, they recruited a grocery vendor that was locally owned to open a grocery store basically adjacent. So I think there's a lot of different ways health systems can do this beyond just writing a check for a food pharmacy or beyond just providing a subsidy, that really looks at sustainable interventions over the long term in their communities.
Yeah, I remember hearing about ProMedica's grocery store that was in the first floor of the new building that they built. And they purposefully put their corporate offices downtown
Yes.
in one of the most economically disadvantaged areas, which has a huge impact in terms of the availability of jobs, but also making that space for really an important community resource. When you talk about slim margins and tough businesses, I also think about healthcare. So,
Sure.
so why don't you talk a little bit about impact investing? Because I think that's something that is a kind of a unique conversation that the Health Anchor Network has really encouraged, number one. And number two, talk a little bit about, we have so much backlash on really ethics-based investing. I see coming down the pike as everything kind of comes under scrutiny. And it feels like the way you're approaching this is much more sustainable than other organizations, investment firms' approaches to their investing, because yours is an investment that actually creates wealth for the community.
And I think the power of it is that it's so linked to the mandate in the community health needs assessment. What we're trying to solve with these investments is showing up in every organization's community health needs assessment, whether it's lack of access to affordable housing, economic opportunity, food insecurity. And so I think healthcare has a really strong rationale for why to make targeted investments. It also aligns and connects the dots between community health, diversity, equity, inclusion, sustainability, civic responsibility, social impact. So that's why I think the power of the Anchor mission is not necessarily to come in and replace the strategic priorities an organization has, but really to connect the dots more intentionally across the different areas that organizations are putting resources, but they're not necessarily always aligning them. They're often very siloed. And I think the opportunity here is how to, especially again, to your point, very tight margins in healthcare. So we can't afford to be using resources inefficiently. We can't afford to be siloed when we should be aligned. And that's what I think the Anchor mission allows. So I think with impact investment, when I think of it, first and foremost, it's a place-based strategy. And healthcare is and it's focused on the places that healthcare knows there are health disparities. And from there is then thinking about, okay, how do we leverage the balance sheet? So you as a healthcare organization have to hold reserves. There are, it's important to your bond rating. It's important to ensure when there's a downturn that you can, plug any gaps in your fiscal budget. It has to happen. At the same time, those dollars can be serving double duty in terms of also being put to work in your community. So they still give you a financial return, but also have a social impact. And the way I think about it is we are asking our health systems to consider allocating 1% of their reserves. And so in that process, and that would be, from my perspective, puts you within the leaders across the country. And the amount of financial return you're giving up on 1% is really a rounding error over the long term for an organization, but it's a game changer for community. And I look at the example of what you guys have done in New Hampshire with the New Hampshire Community Loan Fund, right? It's a very reputable organization. You're not going to lose your money, and you're really providing critical dollars that are going to touch every part of the community you serve with healthcare. And that I think is a low-hanging fruit type strategy that many organizations can start with, which is, okay, here's a very reputable community development financial institution, other type of loan fund. We know we're going to get our money back. We know we're going to get a financial return. And we know we're going to get reportable metrics that said we helped create this many affordable housing units in our community. We helped finance this grocery store there. We helped allow this child care center to open over there, this community center to open over here. So we know that. But then the next level is, while you're thinking about those early stage investments, are what are the type of collaborative investments that might be a little bit more difficult to pull off, but incredibly catalytic. And I think about that as being the Upper Valley Community Loan Fund that you've all supported, equally being an example of, and a really important one, of how to do this in a rural community, bringing together many mission-focused individuals that all had very critical business needs, right? They needed to have housing, not just for community members, but for their customer base, in your case, your patients, and also their employees. So I think healthcare in particular, very focused on people, patients, community, And investment is an area, especially if you think about affordable housing, that's really providing a solution to all three. And so I think it's an area that health systems, as they look at the dollars they have, this is one in which there is a lot of gain that can be created in a short period of time versus some of the other strategies that we talk about.
Yep, you're right. That actually was not a difficult lift, but it did take us about 5 years to work with the CEO Council for Vital Communities, which is our group of employers across the Upper Valley, to get them to a place where they said, yes, we're all going to commit. And everybody didn't commit equal amounts because some of us are bigger than other organizations, but everybody did commit something. And then using a few sharp elbows to bring some people into the fold that should have been in there. And they're happy they joined now. But it does, once you get it going, it is incredibly successful. And we've had a number of developers that will commit to building low-income housing, and low income is not as low as it was years ago. And but housing that a certain percentage of our employees can actually afford. So I think the next step that we're into, though, is single family homes. Yeah. And how do you create home ownership? Because that's actually when you start to see the multipliers, I believe.
And build wealth. Yeah. And I think to your point, that took 5 years, and that's one of the more complicated investment strategies that are out there, right? The effort to make a loan with the New Hampshire Community Loan Fund was, yes, there's always that conversation, getting everyone comfortable with the idea. But once you get the organizational buy-in, it can move very quickly, and you can deploy those dollars. And I think that's kind of the spectrum of way organizations can consider getting started with the impact investment. I think just two things I would add to that is, we actually just had an article in the New York Times just the other day looking at the landscape of organizations supporting housing. And the Healthcare Anchor Network, most of the health systems in the nation that are doing this impact investing strategy participate in the Healthcare Anchor Network. It's still a relatively small number. It's about 20 that have some type of active impact investing strategy. But those 20 have deployed over the last couple of years about $600 million to these impact investments, of which about $450 million is for housing. That sounds like a lot of money, but it's actually really a small percentage of the overall investable assets that institutions have, which for me means that the opportunity is so much greater than what's already been done. And that's what I get excited about. I just think in one of my other roles, I was on the board of a conversion foundation here in Washington, D.C. And we were small, but we had intentional impact investing strategy. And I liked your comment that everyone's been happy after the fact. I've yet to meet anybody who said, we made that investment and I regret making that. Everyone's like, we made that investment and I only wish we had done it sooner, because the benefits have been so tremendous, and everyone is so happy that these dollars are in the community in this way.
What advice would you give to organizations that are considering this? Because I think some people believe that impact investing is some investment strategy that's held by their investment committee, that may be investing in things that are really kind of disconnected from the organization. I think you kind of see that in impact investing in these large firms in New York. You're really talking about place-based investing, and like investment that you can actually see and see the benefits of in your community. So how would you talk organizations through that? Because even though we all, make commitments to many things to be an Anchor Network member, I have a feeling that the biggest lift is over impact investing, but I could be wrong.
Yeah, no, I think you're right. I think culturally it's the most difficult to get the yes, but of all of the strategies, like I said, I think it's the fastest to get the impact. Mm-hmm. And so I think it comes down to a couple of things. One is not being afraid to have the conversation. I think there's often a knee-jerk reaction to saying, oh, we're going to do that last. It sounds the most foreign. We're not familiar with that. Let's start with hiring and purchasing. And those strategies aren't critically important, but they do take a while to do well. They're not as easy as shifting some dollars to a community partner that actually already has the investment acumen to put that money to work. So that's number one. I think number two is recognizing that your traditional investment partner is not going to be the partner to deploy this capital. I think a number of organizations have said, oh, we're going to get them to do it. They're not going to do it. And it's reasonable. That's not their job. Their job is to invest your dollars in traditional stocks and bonds on Wall Street, maybe apply some screens, which is, ESG oriented, which is also not what we're talking about here, right? So I think those are both important. Traditional investment, thinking about putting screens on your dollars, important, but different. And that's really the role of your traditional financial partner. What is needed here is first, I think, a recognition that it's probably best if it's a partnership between Treasury and Finance and those who have knowledge of the community health team, others that can help bring in the relationships that individuals in Treasury and Finance may not have the time to do. It may not be part of their core responsibilities, but I can rest assured that they will get excited about it when community health brings them local partners, because I've seen it time and time again. And then at that point, I think organizations have to decide what is the right relationship in terms of sourcing the opportunities, how you want to vet it, what's your structure. We have lots of different ways that organizations can structure this. It could be everything from creating your own FT. Some organizations like Intermountain, Common Spirit Health have a full-time person whose sole job it is to do impact investing. And they really do have a dotted line to finance and community health. Other end of the spectrum, it's this team-based orientation, or maybe they got a consultant in to help them find some things in their pipeline, and then they decided and made a commitment. UMass Memorial Health in Worcester has actually taken a different approach where they have a committee of folks in their organization, and their CFO spends a lot of time vetting the actual investments that they make. So there's a lot of different approaches, but I think step number one is recognizing that you can do this without losing your money. The return you're going to take will be slightly below what you would expect for that asset class. So if it's a debt product, maybe it's a little bit less than you would get with a fixed income product in your investment. But it's the yield in terms of the social impact, you'll see it immediately. And then it's just thinking about who's the team in the organization that can help move it to actual implementation.
Yep. When I think about impact, I also think about metrics. So who would you suggest after this investment has been made and people start to see changes in their communities? Where is the best place to share those metrics? Because success is going to breed further investments and increase the appetite for thinking about how could they positively impact the community.
So I'm a bit maybe I'm taking this question too literally, but I would say through the Healthcare Anchor Network is a really great way to share the impacts that those investments have. We worked very hard to tell the story of not just what the outcomes are from these, but how institutions have done them and the jobs created, the affordable housing units created. And so we collect that information so we can tell the story of what the healthcare sector is doing. We've worked to standardize a set of metrics. And a lot of organizations can get those metrics from their community development financial institution partner, which is what most institutions will work with to put this capital to work. There are some institutions like Intermountain and UMass Memorial Health that are doing direct investments into projects. Mm-hmm. Most institutions are working with a financial intermediary, and that intermediary can often provide you back where your dollars went, what types of projects, which businesses receive support, et cetera. I think the next step is going to be around how do you start to think about the overall health benefits of this work. We don't have a ton of data getting to that level because that, I think, requires an intentional kind of research study to look at specific projects. Some institutions are beginning to go down that path to say, how can we take the work and show it at that level of impact? But I like to say that there's so much research to show the importance of housing and health. There's so much research to show the importance of having a good, stable job to health. And so if you're investing in those things that you know create those, which there are not enough of in your community, in any community in the US, then you are having an impact on the health and well-being of your community. And frankly, you're doing it without expending precious discretionary dollars that might need to go towards providing healthcare, clinical services, or other priorities. And that's where I think the win is in this. It's about leveraging a static balance sheet to have really incredible impacts down the line.
So for our final question, I'm asking you to share your insights on collaboration. And you articulated this before, that no health system, no matter how well funded or well organized we are, we can't solve social problems alone. It really takes a broad network of community partners in order to do that. So what do you think is the most effective way for organizations to identify other interested organizations to partner or collaborate with community partners in this work?
I think it's a combination of getting out there and talking to them and getting out there and listening to them. As part of, we are working with an organization called Center for Community Investment, and it's a cohort within the Healthcare Anchor Network. And so we've taken 4 of our health systems that are at that point of where they've gotten buy-in, they've gotten the allocation, and they want to build the pipeline of projects. And we're taking them through an 18-month learning process on how to do that. And key to that is getting out there and building those community relationships. And we help organizations understand who they could meet with, whether that's just getting a list of community development financial institutions in your community, whether that's starting to meet with community development corporations, other nonprofits that have been focused on community development and transformation. And I think what's important, at least with this tool that we're talking about today, is making clear that it's not a grant. These are dollars your institution expects to get back, and you're looking for partners that will help you find projects that are investable. Mm-hmm. And so that's going to look like a different person in every community or different organization in every community. But these are some of the characteristics of what they might be. In a nonprofit in the community development space, a nonprofit in that's doing community development finance. Maybe there are some larger partners within the state or local government that have projects they know that need capital. I just got back from visiting a project in Santa Fe. There was a partnership between the state, the city, and a number of local impact investors. So it didn't require actually, and they worked with a national organization that came in that was focusing on ending homelessness. So what's important, I think, is to get out there and to talk and say you as an institution are willing to come to the table. Yeah. Sorry, one last partner on this, because I would be remiss if I didn't say that community foundations, place-based foundations, conversion health foundations are all getting into this space. And I was just on a call this morning with a conversion health foundation that is actively making impact investments and wants to co-invest alongside an institution in their market and just can't get across the finish line on that. But they're a partner that could also make it easy for larger institutions because they have a vested interest in understanding the pipeline of projects and putting capital to work as well.
So David, I'm very familiar with conversion institutions, but a lot of people aren't. So conversion institutions are institutions that are basically grant making, although impact investing maybe now, that are formed when a not-for-profit becomes a for-profit. And they're about 800 across the United States. And there is a list of them on the internet. So that's a really good tip for people to actually find out what are the conversion foundations in their state and see if they can kind of get them aligned on their impact investing. So
yeah. And I would encourage that health systems also nudge their university partners along in this journey as well. Yeah. I think you have done a little bit of that.
We're pretty good at that.
Yeah. Those sharp elbows, they help.
So just one last fun question, David. So I'm trying to think, what type of undergraduate degree did you have? I have a feeling it's either philosophy or economics. Which one was it?
Probably should have been economics, but it was government and politics for undergraduate, and then public policy for master's.
Yeah, yeah. Well, it's served you well.
Thank
So
you.
anyway, it was really great, David, to hear your insights and the work you're doing in our field. And on behalf of the American Hospital Association and Dartmouth Health and all of us in healthcare, I want to thank you for joining me today for this discussion and sharing your valuable insights. And my thanks to all of you for finding time to listen. I'll be back next month for another leadership dialogue. Thank you.